Hello, friends! I'm Jamie Swartz, a lifestyle medicine physician, certified personal trainer, and yoga teacher. Today we'll be talking about balancing waves with the physiology of bipolar disorder and yoga's calming flow. Imagine your mind as an ocean, sometimes serene and sparkling, other times whipped into furious storms of euphoria or crashing depths of despair with no warning from the horizon. For those living with bipolar disorder, this isn't poetry. It can be the brain's turbulent reality, a condition that touches millions, yet remains shrouded in misunderstanding. Today, we'll navigate the physiology of bipolar disorder, what's unfolding scientifically in the mind and body, and how yoga, anchored in evidence-based research, can help smooth those waves and reduce symptoms. We'll infuse faith-centered encouragement, leaning on God's steadfast anchor in our storms, and we'll highlight precautions for starting yoga safely. Let's set sail with clarity, depth, and hope. First, let's chart the physiology of bipolar disorder with accessible science. Bipolar disorder is a psychiatric condition characterized by significant mood swings, manic or hypomanic episodes of elevated energy, euphoria, or irritability alternating with depressive lows of profound sadness, fatigue, and hopelessness. At its core lies a multifactorial pathophysiology involving genetics, inflammation, and mitochondrial dysfunction, disrupting brain circuits that regulate mood, energy, and cognition. Neurotransmitters like serotonin, dopamine, and norepinephrine are abnormally regulated in key areas like the limbic system in our brain, leading to impaired emotional processing. During mania, our brain's reward pathways overfire, causing racing thoughts, reduced need for sleep, and risky behaviors, while depression involves underactivity in these circuits, manifesting as anhedonia and cognitive fog. Inflammation can also play a pivotal role, with elevated cytokines fueling neuronal damage and mood instability. Often, this can emerge in adolescence, and symptoms may persist undiagnosed for years. It can be a progressive disorder, but understanding the biological roots empowers management and reduces stigma. In these turbulent waves, God offers us hope and a lifeline. God sees the storms in our brains and our bodies and our lives and promises to steady us, transforming chaos into a canvas for His peace. So how can yoga, a practice of mindful breath, gentle postures, and inner stillness, help navigate bipolar's highs and lows? Not as a sole treatment, but as a complementary tool along medication and therapy. Emerging research highlights its potential, emphasizing adapted, mindful forms. Current research shows evidence is promising. A 2025 study found exercise interventions, including yoga, can help alleviate depressive and anxiety symptoms in bipolar patients. There's anecdotal and clinical reports that indicate yoga can reduce depressive, manic, or hypomanic symptoms in bipolar disorder. A systematic review suggested improvement in mood stability with regular yoga practice. Some people even called it life-changing. A feasibility study on a 9-week mindful yoga intervention for chronic mood disorders, including bipolar, found yoga attractive and effective as a complementary addition to treatment, enhancing well-being. Why? Well, because yoga modulates the autonomic nervous system, reducing sympathetic arousal, which is our fight or flight system, and inflammation, while boosting GABA, our calming neurotransmitter, and serotonin for mood regulation. As an adjunct, it supports self-management, with mindfulness helping interrupt manic escalation or depressive rumination, where your thoughts are just going over and over around in the head. From a faith perspective, yoga can be a meditative surrender. In a grounding posture, we can embody Lamentations 3, verses 22 to 23. The steadfast love of the Lord never ceases. His mercies never come to an end. This is not just symptom relief. This is creating sacred space for God's calming presence in our storms of life. Precautions are essential for safety with bipolar disorder. Always consult your psychiatrist before starting, as yoga should complement, not replace, medication or therapy. You may want to avoid intense or hot yoga, which could trigger mania. Gentle, restorative styles are likely better to prevent overstimulation. Starting slowly and gently with 10 to 15-minute sessions, and then monitoring your mood can help. Stop if you feel agitated or overly energized. Practice during stable periods. And I encourage and invite you to use props such as blankets, bolsters, or blocks for support and to avoid strain. Let's picture our mind's fiercest wave with mania surging or depression drowning. Now, let's visualize ourselves in a supported child's posture or legs up the wall, with our breath steady, whispering, "Our hope is in God." That act can calm the chaos. Science confirms that yoga can help reduce mood swings. The Bible tells us how God, who calms raging seas, can steady our souls. Let's keep growing and flowing together, and let others see how our stories shine with God's love and grace. Thank you for joining me today. I look forward to seeing you again soon. May God's peace help anchor you.